Well, obviously we use Finasteride, brand name Propecia. We use it extensively in our practice, and it is obviously one of the more important adjuvant therapies when we're going to take on a hair restoration procedure with a patient that may be looking at future hair loss. We want to be able to somehow have some type of preventative or ongoing therapy for these patients to protect their hair. And Finasteride is, to date still the most effective product for doing that. I know there's a lot of information on the internet about it, and a lot of patients are very scared about it, but once they sit with me, we talk to them about the reality of the side effect profile, which is really very, very minimal. And I know in my practice, for example, I've never had a patient have any permanent side effects from the use of Finasteride, not one. So, I know that there's a lot of fear out there, and sometimes it can be made worse, and patients get on the internet and they start looking at this and that, and they get themselves really spun out, really confused. But I think sitting down with the surgeon, sitting down with someone who's an expert in the field, and have them give you an honest assessment, because I know when I've had patients that do develop any side effects, typically the side effects that I'll see a patient complain about is that they're noticing a little decrease in their sex drive. I don't have men come in and tell me they're flat out having erectile dysfunction. We just don't see that.
Gotcha.
But patients will say they're noticing a little difference, and okay, fine. So go to an every other day dosing regimen, or maybe every third day. Let the body acclimate to it. But again, that's truly the exception, not the rule. Most patients that use the medication have no trouble whatsoever. But if they do have a problem, I'm with them. I'm with you 100%. I mean, I tell patients all the time, this isn't life or death. This is hair, and we don't want to do things that cause problems for patients. I don't think a good surgeon ever wants to do that. So I think it's still a very effective medication when used properly, and I think if the patient is given the proper understanding and what to expect, I think they'll do very well.
Is there any other types of preventative treatment? Is minoxidil and or Propecia, is one better than the other, or are they something that work well synergistically?
They do work well synergistically, yes. And reports do show that when you use it in combination therapy, you do get better results than either one of them by themselves alone. But they do work from different standpoints altogether. The Finasteride, the Propecia, that's what lowers the DHT. And DHT is the culprit. DHT is the reason why you continue to lose hair. Whereas with topical minoxidil, all you're really doing is tricking your hair into all of the hair growing into an anagen growth phase. So it's not like that's really doing anything to prevent future loss. Whereas the Finasteride, that really goes to the root of the problem, and it stops the loss, and it can stop it dead in its tracks. And in many cases, I've had patients get amazing regrowth of hair. So it's always going to be one of my first line approaches with my patients.